naturaleza de las cosas. Con David Suzuki.
Cosas, fobias en línea.
It makes them unable to function, no matter how much they want to function. And in their most severe form, it's just as severe and even more disabling than most of the chronic physical disorders.
There were times when traveling through a tunnel, I would have such extreme anxiety. It seemed that we would never get out of the tunnel. Should I get out of the car? Should I walk? And my heart was pounding, and I was afraid that I couldn't breathe, and it would escalate and escalate and escalate.
There we go.
Los síntomas físicos de estos miedos psicológicos son muy fuertes.
What we want to do is begin to get you a little bit dizzy.
Yes.
Los síntomas son tan intensos que hasta el personal médico puede confundir un ataque de pánico con un infarto.
All right, let's stop there.
Ooh.
Okay. Now, tell me the sensations you're experiencing.
Well, I feel, of course, I'm spinning the other way now.
Yeah.
My eyes are having a problem focusing.
Problem focusing?
Yeah. Well, I mean, I'm spinning. So.
Yeah, and if you were a patient, we'd say, are those any of the sensations
Wow.
you experience when you have
And sometimes that is
Oh,
how they
absolutely.
say they feel?
Yeah, we
Wow,
get some patients with what we call audiovestibular kind of types of panics who just feel as if they're going to get dizzy, fall down, and pass out.
So as we turn around the corner, you're going to see quite a height here.
Pero un tratamiento llamado terapia conductista cognitiva expone al paciente a las cosas que más teme.
Any thoughts going through your mind right now about this height?
I'm just hoping you don't ask me to stand there.
Okay, what would happen if I asked you to do that?
Then my anxiety will probably go to a 7 or an 8.
It's just for a regular phobia.
En la Universidad de California, en Los Ángeles, la psicóloga Michelle Krask y sus colegas usan la terapia conductista para ayudar a los pacientes con fobias.
Right.
So you're anxious, but it's...
Cuando las personas con fobias se enfrentan a eso que temen, muchos de ellos experimentan un terror absoluto. Ese terror queda tan impreso en sus mentes que terminan por temerle al miedo en sí mismo. Durante sesiones de exposición, los pacientes aprenden a controlar el miedo.
As you can see, this is a fairly small space. There's a chair in there where I'll have you sit down. The handle has been modified, meaning that you're unable to open the door from the inside. Okay? What level of anxiety does that generate?
Well, I put it more or less, I guess around between 5 and 6. It's starting to rise when you mentioned I could not, open the door from the inside, and my palms are becoming sweaty and so
Okay,
forth.
let's feel.
Yeah.
Right, I feel that.
Yeah, just starting
Right.
to become moist.
Let's just have a look at the heart rate monitor here. Okay, so you're at about 92 beats per minute. Why don't you have a seat? Just have a seat and
Okay.
you're checking the ventilation.
Oh, yeah. Certainly.
Exposure is having the person systematically confront the thing that they're afraid of. If it's haphazard, if they happen to confront the object and don't do it in a systematic or controlled way, to sensitize them. So it is essential that it's systematic, controlled, and by doing that we refer to having completed exposure therapy. So shall we try that? Are you willing to go with that, where I just close and open the door?
Yeah, we might as well see if it gets stuck or not, go through
Okay.
that process.
All right, let's see. I'm closing the door,
Okay.
and I'm opening the door.
Okay.
All right, you see what I'm doing?
Yeah.
I'm closing the door, I'm opening the door.
Okay.
I'll let you go at your own pace and slowly get your hand further in. That's great. You can hold it there for a while. Don't have to push yourself right now. And just get used to that. How's your anxiety like now?
It's a little higher now.
Okay. Good. You're doing a very good job. I can tell you're really focusing on the spider. That's important. No, that is.
No, that's not why I'm focusing on the spider, though.
You're focusing because...
Well, I just want to be prepared.
So do you have an image of yourself falling over the edge?
Yes.
Okay. All right.
Las personas con fobias creen que aquello a lo que temen realmente pasará. Si se deja sin control, este pensamiento negativo retroalimenta la ansiedad del paciente y la empeora cada vez más.
Are you feeling any of the dizziness?
No, but I'm feeling anxious.
Okay. All right. What do you think are the real chances that I wouldn't be able to open the door?
If I was on the outside looking in, probably slim and none.
Slim and none.
Yeah.
So we're close to the zero or at zero.
Yeah.
And when you're thinking about it and getting anxious, it feels like it's a true possibility.
Oh, yeah.
Okay.
Like you won't believe, yeah.
All right. So that's prominent in your mind. So where would you put it on a 0 to 100-point scale?
Realistically?
Realistically.
Oh, probably from 0 to maybe 2, I guess.
So every 100 times I close a door, it happens twice that it gets stuck.
Oh, I don't think so.
No, it hasn't happened.
No.
So even that is an overestimate.
Yeah.
So it's important to catch the thoughts when they happen.
Mm-hmm.
And say, there's that thought, let's question it. Let's really try to put on a different role, become an observer of myself and question those thoughts.
Mm-hmm.
So we'll continue with this for a while.
Okay.
Okay, good. Just like that.
I feel okay like that.
I've worked with patients who have become very angry at me, have sworn at me, although afterwards it was fine. Patients who have thrown up when they're doing exposure therapy. So it does, in a way, take a special person who's willing to go with it, knowing, of course, that in the end it's effective.
Do you feel ready to try to touch the spider without the glove? Or would you like to try the latex glove?
I'll try it without the glove.
Okay, great.
Let's pull on this rail, pull it towards us. Let's push it away, pull it towards. Good job. Not ready?
No.
Okay. One arm. All right. Other arm.
I'm not going to really lean on it. I'll just rest my arm on it.
Okay.
Los pacientes responden rápidamente a la terapia conductista. Una sola sesión puede producir resultados sólidos.
We're on.
Mm-hmm.
That was 5 minutes.
Oh, okay.
Great job.
Yeah.
Just have a look at the heart rate monitor.
Oh, really? Oh. I'm about 77, I guess.
77?
Mm-hmm.
All right.
Huh.
That was great to watch this. Well done, Ron.
Oh, thank you.
That
Thank
was
you very
great.
much.
Boy, that's hard work for you, too. You really have to concentrate and
That's right.
try to follow what he's thinking and talk him down. through
Right.
that.
Trying to capture some of the thoughts is the important part. Did you think that it would have been this quick?
No, I thought it would be just like, I'd be breaking down this door and going like, oh shit, let me out. Excuse me. I mean, you know, let me out of here, you know. And I'd be panicking and
Right.
doing crazy stuff
Right,
like I normally do.
Ron was fairly tough. He went through it fairly quickly. Some people it takes a little longer than this. But generally speaking, it's fairly dramatic.
And the prognosis for Ron in terms of
It's great.
elevators is...
Yeah. Practice with elevators.
What's your anxiety like?
You know, it's actually mild.
And you're touching the spider.
Yeah.
You see so many people who are really so happy after going through the treatment. They've been able to accomplish something they never thought they could. One issue that's sort of important there is that if there's too much of that sense of did I really do it or not, that to me would be a signal. I think we need to do it again so you really understand that you have done this.
Okay.
Good.
I can deal with this.
Good. All right.
Still dizzy, but not as anxious. I'm okay. Not anxious. I'm excited.
That's great.
Oh, boy. Wow.
It's always my heart starts first. It just starts racing really rapidly, and then sometimes I feel really dizzy and just sick, and I feel like I'm gonna die, and I'm cold all over and shaking a lot.
Jenny, quien estudia música y quiere ser cantante profesional, padece de un tipo de ansiedad que experimentan muchos artistas.
Some of the worst experiences I've had is getting up in front to sing and nothing would come out. I could not sing at all. Just literally, no. None of the notes would come out, so that was very frightening.
All of our severe anxiety disorders or severe emotional disorders can tell us, on the one hand, this is irrational. I know there's nothing to be afraid of. I know there's no reason to be this depressed. I know there's no reason to have these thoughts. They're totally irrational. But on the other hand, when I'm having them, they dominate my life. I really am
El tratamiento dura varios meses. La terapia conductista funciona con los trastornos de la ansiedad.
What I'd like to ask you to do today is to sing in front of a group of people. How do you feel?
I feel pretty nervous about it.
Sure.
Yes.
Otras terapias ponen más énfasis en las causas de la ansiedad, pero el conductismo se enfoca en los síntomas.
The analogy is if you have a broken leg, what we want to do is fix your leg, set it, and get you walking again. Eventually, we may want to go back and see what you were doing that was so stupid that made you break it in the first.
Yes. Okay. I will be singing Sense for My Dear by Henry Purcell. Sense for my dear, my dear.
We want to deal with the present. We want to deal with the here and now. We want to create these symptoms so that we can work with them right there and help the patient to overcome any fear and anxiety.
2 months ago, I would have just really been panicking. My thoughts would have been out of control. And with some of the techniques they've taught us there, it's really about, how you're thinking, to calm yourself down, doing a lot of deep breathing. And so today, before, I have all these tools now I can have before.
Every year, new developments come along to help make these treatments even more powerful. One good example is, of course, virtual reality. It's going to be a godsend for hundreds of thousands of people suffering from severe phobias, where we have difficulty recreating the situation.
It's probably like a 60.
El miedo a volar es una fobia común. Trish padece de ella desde su adolescencia.
How similar to how you feel during an actual flight is this?
I'm feeling it in my upper body, my back, like a tension, and I'm taking really shallow breaths. I think my heart is beating probably less rapidly, and my hands aren't as sweaty.
Okay.
But it's still realistic. It's the most real that I've felt. I mean, it really plain.
What happens when I fly is I fly. There's too much time between the times that I fly, and I build myself back up again so that it's like I've never flown before. My anxiety gets up there, whereas if I have an opportunity to fly like this over and over and over, I think it would make a big difference.
Are you all right if we move into a slightly rougher flight?
Okay.
Okay, so we're going to be experiencing some turbulence and flying through a small thunderstorm.
Small thunderstorm.
Okay, it's going to happen pretty quickly, all right?
Okay.
The thunderstorm is something that I can honestly say I've never flown through. If I had, I'm sure I'd be extremely anxious. But I think even that is something that, if I could practice, I wouldn't get the panicky feeling.
And typically, if this were a real flight and we were about to land, how anxious do you think you'd be? Much more anxious?
I'd be like off the scale.
Okay.
Rum.
We inherit a tendency, precisely, or at least we don't think so. And we don't inherit panic attacks precisely, but we do inherit kind of a general tendency to be high-strung and maybe a likelihood to experience these things.
Comenzando con niños de 4 meses de edad, el doctor Jerome Kagan de la Universidad de Harvard ha identificado a niños propensos a la ansiedad y a aquellos que no lo son.
Blair is being presented with those interesting, colorful dolls, as you can see. And you'll notice that she's not highly aroused, she's not thrashing, she's not a lot of tension, and she's not crying. And those kinds of children become extrovert, sociable, not very fearful. If we look now at Lisa at the same age, looking at the very same stimulus, those colorful dolls, you see how tense she is. Look how she's thrashing her arms. And these kinds of children are biased to become shy, subdued, timid, and avoidant in the second and third
Now,
years.
I can see a certain biological survival value to that. I mean, if something comes and they're startled and that'd be a selective advantage.
Well, species studied, there are fearless ones, and it must be that each form has an adaptive quality. And if you thought about it, that would make sense, that every species needs a few bold ones to protect the group, is that metaphor, and a few timid ones to stay back and not get injured, which means that you're right. There's a bit of advantage to both styles. So here is Lisa at 21 months. See, she's entered this room with her mother. She's never been in this room.
She's clinging to her mother.
Very reluctant to explore, quite apprehensive. Even though there's no one else in the room but her mother, the strangeness, the newness of it has made her timid. So that's really a classic example of the behavior that we call inhibited. So now you see Blair in the same room, and mother at once, she bounces on the mat. Oh, timid. Same room.
And this continues right on when they're 4?
Well, here Blair is being interviewer. She scribbled in this brand new book. Now you see, she isn't intimidated, so she says, "Oh, why should I do that?" And that's a classic behavior of the uninhibited. Now you see, now she's being asked, rip up the card, and that's, since that's perfectly okay, she smiles and she does that because she knows it's okay. Even though she's, yes, she wonders, you know, why do you want me to do that? She engages the adult in a...
She's always smiling and just so alert and...
We saw 400 children, and she had the most frequent, the highest number of smiles of any child.
Let's have a look at Lisa.
Yeah,
in
well,
contrast.
Lisa, you see how Lisa just very obediently does every task, right? She does what she's told. She doesn't question. She doesn't talk. She's told to do something, and she does it, and of course, no smiling. The more fearful children are intimidated by the examiner, and so they don't have the courage to what the adult asks them to do.
Contrast is amazing. I have a daughter who's very... This, of course, is a kind of impediment in society. But I've always been afraid that as we anxiously try to draw her out, we may actually further into her shyness.
It's an art form, but you don't want to overprotect such children. We now know that if you overprotect high reactive infants in the first year, then you make it harder for them to become average or more sociable. And it's better to treat them with the philosophy that recognize that you're a little easily aroused, but life's tough, and I'm going to help you get ready for life.
Aunque no llegan a ser en verdad con el tiempo, tímidos como Lisa, de 8 años, adquieren más seguridad.
Can we go in the sandbox? Sure. Okay. Oh, you just pulled out, huh?
En Charleston, Deborah Baidel usa la terapia conductista para tratar a niños con timidez tan severa que justifica la denominación de fobia.
When you meet a shy child, initially they may seem very withdrawn. They don't really interact. But if you give them 10 or 15 minutes, they start to warm up and they start to act like other children. Children who have social phobia have a much more severe condition. They don't warm up after a few minutes. We're talking about children who have some limitations as a result of the condition.
A uno de esos niños. Ella misma recuerda cómo era.
When people cry and I didn't do my oral presentations. Sometimes I think I got bad grades because that was like a main part of it. And I was worried like what people would say about me because I cried so much. And I sat by myself and I didn't talk to anybody. And some people would say hi and some people would come up and they'd say, "Are you antisocial?" And that would make me cry. So I spent a lot of my time crying.
Sarah told me that she was one of these kids that years later kids would not even remember being in their class because she didn't speak. And she dressed to blend in, to never draw attention to herself.
Era Sara cuando la atención de la ansiedad en la Universidad de Carolina del Sur.
The first day that I went to the clinic, it was like terrifying. I went and looked people in the eyes and I'd keep like bunched up and I'd be like fidgety. My clothes were like dumpy and I wore that jacket, so I guess people thought that was the only thing I wore, but I have it zipped up and I'd be like...
Interacting with other people is one way that all of us learn social behaviors. So if you don't have the opportunity to be around other children, you don't learn those skills. So an important component in our program is to have the children learn the types of skills that other children have learned naturally. Well, what we're going to do today, we're going to learn how to give compliments. And I have some cards that have some compliments on them. And so I will give you some cards. So at first, we don't have to really think of the compliments. We can just read them and practice giving them, okay? So here's a card for you. If you can think of your own compliments, that's so much better. All right, let me start out by saying, "Hi, Kent, how are you today?"
Good.
What's new?
Nothing really. You're the coolest kid.
Thank you very much. I think you're cool, too.
Actuar y mostrar en el ambiente seguro de una clínica es una cosa. Usarlas en el mundo exterior es otra. Las sesiones de exposición ayudan a jóvenes como Sara a superar temores tales como ordenar en un restaurante. Y en el curso de 12 semanas de terapia, adquieren más seguridad para socializar con otros niños.
It's done a wonderful change for her. It's like night and day. So no, it's good to see her now, happy, doing things, and actually enjoying them.
My life is very, very different because I actually have a life now. I'm in charge now instead of... I don't have to listen to that anymore.
I'm much better about washing now because I used to, every time we went to a restaurant or anything, I'd always go straight to the bathroom before we ate or before I did anything and always wash my hands, or mostly any time I did anything like really important where I needed my hands to be clean.
She's always been very anxious, kind of a worrier. Her hands used to get chapped, but I thought it was hands getting chapped. I didn't realize she was washing them continuously.
Hasta que fue diagnosticada hace 6 meses, la condición de Larissa era un misterio.
She was showing some signs of being very unhappy with herself, in that she was saying she was worthless and life wasn't worth living and she was a bad person.
Like with my teachers, I always think, oh my gosh, I cheated on a test or something. Or sometimes I'll make myself believe I've stolen something or I've cheated or something like that.
She was worried she would hurt herself, or that she was worried that she wanted to hurt other people. That she would do things because she's very fond of little kids, and she was worried that if she was with little kids that she would hurt them. And some sexual thoughts she was having.
I have obsessive-compulsive disorder. I think I noticed it because I was watching a thing on TV about it, and I noticed that I had things like that, or something like that. But I noticed I had it from, you know, hearing what it was actually about. And so when I noticed it, I told my mom, as a joke kind of. But it really worked out that I had it.
John Piacentini dirige un programa de terapia conductista sobre el desorden obsesivo-compulsivo en la Universidad de Los Ángeles.
An obsession is a repetitive or intrusive thought or image or impulse or idea that's disturbing to the person. That's something that they don't want to think about. And it comes into their head and they can't get rid of it. And it really is distressing or upsetting or bothersome or frightening.
I felt like if I went into a store or anything, I always checked my pockets, did I take anything? And it seems so stupid, if I didn't have it and heard somebody saying this, that they think they stole something, I'd say to myself, just think, did you take anything? And then you didn't. But it really is hard,
To try to make these thoughts go away, individuals with OCD will then use rituals. They'll come up with some kind of a ritual or a compulsion to deal with the thought, to make their anxiety or distress disappear.
Usually when I count, I do it in my head, or, when I use my fingers.
You're not using your fingers. Oh.
Well, I would use my fingers, go 1, 2, 3, 4, whatever. But it really didn't show that much. I also gotten things I have to say certain things, like 8 times or something. It started off the word I have to say a lot is God forbid, because I always think if I think of something bad, I'd have to say God forbid or something. And then it would work out, now I have to say it 8 times,
A compulsion basically is any kind of a repetitive movement or behavior. It can be mental, such as praying or counting or thinking in certain ways. It can be an actual physical behavior like hand washing or tapping or something like that. But the purpose of the compulsion is to basically deal with the obsession or make the obsession go away. What's your feeling thermometer right now?
El miedo a la contaminación es común entre los pacientes de DOC. Las sesiones de exposición los ayudan a ver que sus angustias son exageradas.
What is this?
It's like blood.
Why don't you grab that?
Now this, it goes up.
Okay, where's your feeling thermometer going to?
It goes up to a 6 or a 7 or something, because I think, oh my God, is this contaminated blood with a lot of germs in it and stuff?
Why don't you hold it with your whole hand?
And if it is.
Does that make your feeling thermometer go up higher?
Yeah.
Okay. Do you wish you could put that down and go wash your hands right now?
Yeah, and go really scrub them to get everything off.
What would that be doing to your OCD?
It would kind of be letting it bother me instead of taking care of it, showing that it can control me instead of I should control it.
How about if you touched it on your face? Would that make you more nervous?
Yeah.
Okay, why don't you touch it on your cheek? Okay, really do it a lot.
Makes me nervous to think that, you think in some ways that it might cause something or might actually cause me getting AIDS, which scares me a lot. But then again, I know in some ways I can't, so it's kind of like voices in your head telling you different things.
Well, you're doing those voices.
Thank you.
Otro síntoma de DOC son las voces persistentes que expresan ideas contradictorias.
Where's your feeling thermometer?
It still really hasn't changed that much. It's still around 5 because I'm scared, but I'm not totally scared. It's kind of going down, I guess. I still, I guess, will always have the fear of it, but not as much. And it won't take over my life anymore.
Well, that's what we're trying to do, is to keep these fears from interfering in your life. So just remember that when you're doing this. Remember why you're doing it.
Right.
Not that we want to just stick blood all over you, because we don't. But you're doing it so you can get your life back.
Right. Kind of gross.
In general, there's no cure for OCD, and we look at it as a lifelong condition. And a medical analogy that we oftentimes use with the parents and the kids is like diabetes, that we can...
Compared to a lot of other kids who are on medication and stuff. But I'm sure, for me, it helps me knowing that there is some way, it's like when you're sick, when you've got a stomach ache, and when it's like a cold, you feel better because it's something to get over. So it's like with OCD, I know I'm not crazy, I know I'm worrying about something, but there's a way, it's not the end of the world and I can overcome it.
Randy Frost es psicólogo en el Smith College y tiene especial interés en un síntoma poco común del DOC. Beth ha padecido de DOC durante muchos años.
makes me extremely anxious because I see the salt as a destructive force. You can see it on the rust on the cars. It's not the sand. I always say sand and salt on the road. Sand is something friendly. It's from the earth. I like things that are from the earth, but not the earth too. But I've seen what it can do, and it makes me nervous on the... You won't find... Actually, I have 2 sealed packets of salt in case I want to, you know, like you get at a fast food joint, in case I want to use them in cooking. A little bit of salt in cooking, but other than that, this is a salt-free house, and it's not just my high blood pressure.
Well, why don't we take a tour of the rest of the house?
Okay, here we go.
A Beth le gusta amontonar cosas.
Welcome to what I call the warehouse.
Okay, now what is all this?
This is all my stuff. A lot of it is paper. Books. About a 2-foot wide and 4-foot deep path. I call it excavating.
Hoarding behavior occurs in people who hoard have difficulties making decisions about what to keep, and these people typically have trouble making any kind of decision at all.
Una de las razones de esta indecisión son las voces interiores asociadas con el DOC. Voces que permanentemente debaten los pros y los contras de toda elección. Por eso, incluso ordenar en un restaurante se vuelve una dura prueba. Tomar la decisión más simple se torna algo casi imposible.
This is supposed to be empty. This little round table is supposed to be empty.
If we were to watch you making decisions about throwing things out or where to put things, what would we see?
Well, it's 2 different things. Throwing things out is very... The minute you say the words, it's very threatening. That's
so just
permanent.
the word.
Yeah, immediately it's like, oh, no, wait a minute. Hold on a minute here. So it's almost like I have to deal with them as 2 separate entities. The first one you said was...
throwing things away. How do you...
Oh, you want to know about the hard one?
Yeah.
Well, throwing things away, the date would be important, like how long I've had it.
So upstairs is your bedroom?
Yes, upstairs is my bedroom.
And on the 3rd floor you have a guest room? We don't know a lot yet about what kinds of childhood experiences lead up to this. We do know that people who hoard tend to have more first-degree relatives who are clutterers or savers or collectors than people who don't hoard. So it looks like there's some kind of family involvement, but we don't know yet whether it's genetic or whether it's some kind of model behavior on the part of children as they grow up in a home that's cluttered. Now, the things that are here in these piles, do you think of them as having a place they can go outside of here?
I wish.
Is this where they feel like they belong, or?
Well, ironically, this is the chair from my childhood where I always sat to have my long hair. It went to my knees where I dried my hair. It's a very sentimental chair for me for that reason, but it's also a very comfortable chair. Although it's a lawn chair, it has very comfortable inner springs, and I always really liked it. And it's supposed to be there so that I can relax and watch TV. Obviously, instead it's got, more than anything, it's got books, laundry, and mending. I think they're the main 3 categories, and they just sort of ended up there temporarily.
Al igual que muchas otras personas con trastornos de ansiedad, Beth vive su condición alegremente y hasta con buen humor. Pero el precio de esta condición es alto. El aislamiento y la depresión. Algunas veces hacen la vida insoportable.
I would get dizzy, disorientated. It would probably affect my speech. That things would become choppy because I was consumed by the fear in my body. It progressed to such an extent that I became afraid of even being in my body, and that I thought that I had to somehow escape from my body. And at one point, I even held suicide as an idea of, if the absolute worst happens to me, then in this fear, the feelings of the fear, then I can kill myself. Make it stop. That will be that's one way that I can make it stop.
Marlene padece del síndrome de depresión postraumática, comúnmente asociado a los veteranos de guerra y sobrevivientes de desastres. Pero su trauma fue diferente.
When I was 9 years old, I was raped by a family member, which is significant in that sense of safety. I was not able to develop a sense of safety. And as a child, it affected me in that fear, simple things such as getting on a merry-go-round, going through a fun house, were frightening experiences. Over time, the fear became more pervasive, affected me to the extent I would not leave my home. I was homebound for approximately 3 years.
Tampoco ayudó el que Marlene recibiera diagnósticos errados por más de una década.
I had many terrific doctors at the best hospitals in Boston. I was diagnosed with many, many things. I was treated with many drugs. Drugs were never wholly successful. I was on a variety of antidepressants, medications for panic, lithium, mood stabilizers, medication after medication after medication.
Finalmente, Marlene fue enviada al doctor Michael Otto del Hospital General de Massachusetts, quien identificó sus síntomas.
If I touched the glowing coils on a stove, I learned pretty quickly not to do that. It sort of, memory gets etched into me not to do that because of the degree of pain. Post-traumatic stress disorder is similar. But what gets etched into me is fears of all the stimuli associated with the original trauma. And so things that I saw, smelled, times of day of the original trauma, things I felt within my own body, the anxiety I felt, all can serve to cue my emotional system, where my emotional system will try to warn me, be careful, it may happen again.
El síndrome de depresión postraumática no tiene cura, pero la terapia conductista y ciertos medicamentos lo hacen controlable.
So give us both a reminder of the sort of cues that may set off trauma memories.
The seasonal cues, I can feel the time of year coming, when the days get shorter, when it's cooler at night, and it's approaching it's the same time of year that I was raped. I feel it, I sense, and I start to have anxiety, but just that I'm uncomfortable with things.
So that's your body starting to go into alert mode, trying to warn you of that bad event that happened.
And I become very vigilant and very cautious.
And what are some of the individual cues, the things day by day that may set you off, increase that vigilance?
If I find myself in any kind of situation where I feel that I'm not safe, to me that it seems that I'm not safe, and that can be that there's no other people around, that there's no one to be able to yell to for help, someone that can save me, rescue me. If I'm in some place closed, that I feel that I can't get out, that I can't get away, and that can be as simple as a closed door, a closed room.
Okay, why don't we use that for rehearsal today? And what I'd like you to do is look at the door and let the thought be there of you're trapped and you can't get out. You will feel emotionally the old meaning of trapped, the rapist meaning of trapped. but also let yourself feel at the same time the adulthood, meaning that it's okay that the door is closed, and that you have freedom to do whatever you need to do with the door closed.
You described the historical part of what it meant for the door to be closed and to be in a closed space. I can feel that, and I know that feeling. But I also know and can make that distinction of that closed door doesn't pose a threat to me now, that it is a historical experience. It doesn't frighten me as an adult. What we progress, and therapy will discontinue.
Durante muchos meses, Marlene ha tenido que tomar conciencia de lo que siente para alcanzar este nivel. Incluso hasta enfrentarse en la terapia con la fotografía del hombre que la violó.
There is things that I want to do that hold a certain amount of fear, but I will do them. And it's because of what I've learned that I have taken away from therapy, this idea that I can be my own therapist. There is things that I want to do that hold a, but I will do them, can do them. And be my own therapist.